Well, good morning, Queensland. I hope you're having a lovely Boxing Day wherever you are in the state and whatever you might be doing. But please ensure, if you're out supporting our businesses across Queensland, particularly our small and family businesses with our Boxing Day sales, please make sure you wear a mask. It's the most important thing you can do today, other than spending money in businesses, which helps those businesses and the Queensland economy. Today I'm pleased to report that there are 714 new cases in Queensland, COVID cases, from the last 24 hours, which is slightly lower than the previous day. That brings to the total number of cases in Queensland, the total number of cases now 2,857, with 29,918 COVID tests done in the last 24 hours, which brings us to where we are here today. And this, of course, is just above us in this facility is Queensland's premier dedicated COVID testing laboratory, the Queensland Infectious Diseases Laboratory. It's one of the unseen engine rooms of our state's response to COVID-19, which has been running now for almost 2 years. Since the start of the pandemic, there hasn't been a day, there hasn't been a single day when laboratories like this one, which is run by Queensland Health, or private testing laboratories, have not given us a first look at what COVID is doing to Queensland. If COVID is a battle, testing is the front line of reconnaissance. Every day COVID numbers tell us what is happening, whether it's low thousands or almost 30,000 in the last 24 hours. These results have been processed by diligent, hard-working, absolutely dedicated professionals, working, as I say, in government laboratories, but also in private laboratories around Queensland. And so while our strong and effective health response to COVID-19 has been down to the hard work of Queenslanders, that's very much been because of the hard work of the staff in laboratories like this. So Christmas is a time for Thanksgiving, and today we give thanks to all of those people who worked in pathology and in testing labs, in labs like this one around Queensland, who have not stopped working, just as they are working all through Boxing Day today. So the single biggest thing we can do as Queenslanders to help them is to get vaccinated. Whether it's your first shot, your second shot, your booster shot, it is never too late to vaccinate. I might hand over to the Chief Health Officer, Dr. John Gerard, to say a few words, and then I'm happy to take some questions along with the Chief Health Officer.
So in the last 24 hours, we've had 714 new cases to report in Queensland. This is slightly fewer than the preceding 24 hours, and it almost certainly has something to do with Christmas, perhaps people not coming forward to get tested over Christmas. So it won't surprise us at all if in the next couple of days the numbers get substantially higher, and we would not be too concerned about that. That would not be a surprise. It is still very interesting that there are only 7 patients in hospital who are there because of symptoms of COVID, and no cases in the intensive care units or on ventilators as of last night. That's despite having 2,857 cases of COVID currently active in Queensland. As you've heard, this brings the Queensland total to 5,032 cases, so more than half of the cases we have seen in Queensland, we have seen since the borders opened last week on Monday, the 13th of December. In terms of testing, there were 29,918 tests completed yesterday, and I really want to thank everybody who came out on Christmas Day to get tested in the warm weather. So thank you very much for those people, particularly those who may have had symptoms of COVID, who've come forward to get tested on Christmas Day. The case locations, again, right across Queensland, they haven't changed, so I'm not going to go through the list of LGAs again. They're right across Queensland, from the north to the south. What strains are we seeing? It's about 75% of the viruses we're seeing are the Omicron strain, sort of stable at that percentage, around 75% Omicron, about 25% Delta. We're moving more and more patients out of hospital, people who've been stranded in hospital because they have nowhere else to isolate. So we have 714 people who are being managed very, very successfully at home with mild symptoms of COVID. We still have 93 patients in hospital, which includes the 7 who are actually symptomatic, who still have alternative places that we need to move them to. They may have other medical conditions, for example, but happen to have COVID. There are other reasons why they're in hospital. But at this stage, only 7 patients who are admitted to hospital with symptoms related or directly related to COVID, and none in intensive care, none on ventilators. In terms of vaccinations, being Christmas yesterday, neither the state nor the Commonwealth reported vaccination rates yesterday. I was asked a question yesterday about hospital staff and who are in quarantine, who have tested positive for COVID-19. We have tens of thousands of healthcare staff in Queensland, so it is not at all surprising that some of them will get COVID, and that will continue to be the case, and those numbers will rise. As of last night, there were 55 hospital and health service employees who have been confirmed to have COVID, and just over 300 hospital and health care staff are in quarantine as a result of a close contact, either in the community or in the hospital environment. There's one other issue that I just wanted to bring up briefly, and that pertains to the vaccination of pregnant women. We've noticed that there are a lot of women who are not pregnant women who have not been vaccinated against COVID-19. COVID-19 is a very bad infection to get during pregnancy. It's bad for the mother and it's bad for the unborn baby. The vaccines that we have available, the Pfizer vaccine and the Moderna vaccine, are safe and effective to give during pregnancy. So please, please, can I make a specific appeal to pregnant women to get vaccinated now, because you are likely, if living in Queensland, you are likely to be exposed to the virus in the coming weeks. And we know there's a safe and effective way of protecting you. Thank you very much.
Would you like to ask questions? Dr. Gerard? Yeah, certainly.
Dr. Gerard, will we get to a point where there's so many cases that it's going to be too hard to release all the exposure sites?
That's a very good question. As we move forward, the degree of contract tracing will be reduced little by little, and we're already slowly reducing the amount of contact tracing we are doing. It will be a gradual process. So we're still releasing those sites at the moment, but the numbers will be decreasing as time goes by.
What's going to happen with that? There's now 300 health staff in quarantine. What's going to happen with our health services as more and more health workers are in isolation?
The healthcare services, I mean, we always have a certain percentage of the staff who are sick and away from work. All the healthcare services are functioning well and have plans to deal with this. So at the moment, we have no issues. I mean, obviously, it is one of the things that will put a strain on hospitals. There's no question about that. But all healthcare services have plans and they are managing well.
In terms of those 7 people that are in hospital, can you talk us through what level of symptoms
they're? Yeah, I can a little. Mostly the symptoms are not particularly severe, interestingly. We've seen, and I've spoken to Kerry Chant about this, we've seen some people with some abdominal symptoms, interestingly, diarrhea and dehydration. It's one of the things that we've seen more than severe respiratory disease. But can I actually, there is one thing I really do have to emphasise here, and this actually is very important. 3/4 of the patients that we have seen in Queensland to date, in the last 2 weeks with COVID-19, have been under the age of 35. So under the age of 35. So it's a young cohort. We haven't seen a lot of older people with the infection at this stage, and hopefully the older group are getting their 3rd dose of the vaccine as we speak. And I think we've seen those with the numbers that every day we're seeing large numbers of the more vulnerable coming forward. So at the moment, it's a bit hard to draw too much of a conclusion, and I probably don't want to overstate this issue of these patients not having a lot of unwell patients, because these are young. 3/4 are under the age of 35. And there's one other important point that cannot be overemphasised. That is, even if there is a small percentage of people with COVID-19 who get seriously ill, when we get very large numbers of patients with the infection, which we inevitably will in the coming weeks, this will put a strain on health services. There's no question about that. We know that. We have plans in place, but it will put a strain on services. Even just a small percentage of a very large number is still a large number. We haven't seen it yet, but we're expecting it and we're planning for it.
Are you putting those patients that are turning up having less vaccination than some of the older patients? Is that what you're explaining? That the older patients may, or the other people who may not have received COVID or be treated for COVID have had their third shot? And so the under 30.
What I'm saying is that's 3/4 of the patients that we've seen diagnosed in the last 2 weeks are under the age of 35. It's probably related to the behaviour of young people. They're more social than people who are over the age of 35. So we've known that from the beginning, that younger people are more likely to get this infection, even though they tend not to get as sick. Maybe I didn't make that clear. So they tend not to get that sick. So I don't want to overemphasise the fact that we don't have anyone in intensive care. It's interesting, and we're watching it with great interest, but our age group is young.
And the 7 who are in hospital, are they fully vaccinated, not vaccinated?
I don't have all the numbers. I can't recall. Quite a few people who have the infection have been vaccinated. The vaccine seems to protect you mostly against severe disease with Omicron. None of these 7 have severe disease. None. But it is early days. It's early days because we're going to be seeing tens of thousands of patients, and we haven't seen a big spread among the elderly group yet. So things are likely to change in the coming weeks.
When will it get too hard to manage cases at home? When cases rise, how many resources are available to ensure people?
Well, we want, that's our aim, to manage the vast majority we managed as home. We have processes that are coming in place and increasingly being used to manage them at home. Because the majority of people aren't that sick, so they can be easily managed at home. And I have heard reports of people who aren't particularly unwell learning of their COVID diagnosis and presenting to emergency departments. That's really not what we want. If you're not sick with COVID, please don't go to the emergency department unless you're breathless, you have chest pain, or you feel significantly unwell. So don't just because you have COVID-19, that's certainly not a reason to go to the emergency department. And we have been hearing reports that people learn their diagnosis and go straight to the emergency department.
Have there been any super spreader events linked to any of these cases?
Oh, look, there are regular clusters. There's so many. This has become widespread. There are lots of clusters occurring all the time, and I can't even list. I can't list them. Well, if you say super spreader involving hundreds of cases, other than ones we mentioned previously, there was an event early on associated with graduation ceremony. That's a while ago, but there are lots of clusters all the time.
Do we know how long? Sort of asking how long is a piece of string, but we didn't think we'd be still doing this 2 years ago. Do we know how long we might be doing this in the future?
No, I think we can't answer that yet. It's too early to answer that.
When it comes to testing, we've spoken to people who are now sort of in their 5th day waiting for test results. Is that something that we're seeing across the board now? Is testing just getting too overwhelmed, or how does that look?
Our turnaround times for testing in Queensland are pretty good. Certainly compared with interstate, our Queensland turnaround times are pretty impressive. My daughter had to be tested, had her day 5 test after she arrived from interstate yesterday, and she got her result back within a few hours. So she was probably lucky. I think for many people it's a bit longer than that. But our turnaround times, compared with Sydney, as she tells me, are very much faster.
Minister, can I ask you just on that? The New South Wales Health Minister has pleaded for a decision to be made regarding rapid antigen testing rather than the day 5 PCR tests. Is that something that the government is willing to bring forward in terms of the...
Well, we've said we'll consider that over time and look at how the current policy position of the government might be changed from the 1st of January, but there's no change to that position at the moment. But we'll continue to monitor it, take health advice. What's the safest way to test the community? Testing is very important to identify the virus, who's infected by the virus, and then how it can be managed. So we need to have high standards.
There's no chance of that date being brought forward?
No, not at this stage, no.
In terms of people trying to travel to Queensland, they're struggling to get a test back within that 72-hour block. As we heard interstate, there are some delayed testing results coming through. Should that 72 hours be extended given the burden on the system at the moment in regards to testing results? Well,
the overwhelming majority of people who are being tested in New South Wales are being tested because they're concerned about being infected with the virus in their home state. And that's not surprising. This is a state that let the virus get out of control, and it caused untold damage to lives, to livelihoods and to business. We know the budget deficit, for example, in New South Wales this year is $20 billion. Their budget position, their fiscal position has been wrecked by the virus. Our budget deficit is less than half what we predicted it would be. It'd be $1.5 billion. So that's just the money. And then we look at the hundreds of lives that were lost. So people in New South Wales are naturally very concerned when they hear they might be a close contact and are going to get tested. So the pressure on the testing system in New South Wales and other states isn't because of people wanting to travel to Queensland. And this is also the same testing regime for other states like South Australia and Tasmania and Western Australia. So we're no different to other parts of the country. So we're not looking at changing our position at this time.
So despite the fact that there would be people who would be in the same mix as just going to get a test to come into Queensland, it would be the same people who would be going to go get a test because they fear of being close contact. It's not their fault that they're having to wait for so long. Would the Queensland government consider extending that 72-hour window?
Well, that sort of suggests it's the Queensland government's fault for not standing up appropriate testing. That's entirely a matter for New South Wales. We have a standard that we've set to protect our people, and that's what we've done all along to keep our people safe, to take a careful and cautious approach to responding to the virus, which is what we're going to continue to do. But the virus is unpredictable. Circumstances change. We constantly monitor these things. We take the advice of the Chief Health Officer and his team. We take health advice. So we'll continue to monitor this, but the current position of the government is not to change that, to keep our people safe. But as case numbers rise, as things change, we'll always continue to monitor it. But there's no change at this time.
There won't be any change in the next 2 weeks, you foreshadow?
Look, I'm not anticipating any change, but we'll just see how the next 2 weeks rolls out and see what the impact of the virus is on Queensland.
Is the government expecting staff shortages for a range of services across the government, not just in health but in education and transport, due to these escalating case numbers and the number of people who need to be in isolation?
I think we have a very large workforce in the Queensland government. The two that you've identified, the health workforce and the education workforce, of course, are the two biggest single employers or employee groups in the government. The largest number of workers are in education and health. So, as the Chief Health Officer said, we obviously build in capacity for people on sick leave who aren't otherwise able to come to work, people on long service leaves and so on. So we're confident we can manage that impact at this stage. But again, we'll continue to monitor that and see what happens over time.
Treasurer, in order to keep the government coffers nice and filled, debt collectors, we're hearing reports are being called in to recoup hotel quarantine bills. Is that happening?
Yes, I understand that's the case.
Yeah, and why is that decision being made to take such a drastic decision?
I wouldn't describe it as drastic. It's obviously the government seeking to recover money on behalf of Queenslanders. So this is money that is properly and rightfully owed to Queenslanders for a service, a fee that's been charged for providing hotel quarantine to people. And so we're just seeking to recover that. Obviously, we're seeking to use a form of recovery that doesn't take our frontline staff away from their work. We're not going to put health staff on that. They've got better things to do to manage the pandemic. But it's important that people pay what they agreed to pay and pay it for the benefit of Queenslanders, because the money that we recover can then be put back into our health response, in particular to COVID-19. And we have, of course, had one of the leading responses, not just in Australia but around the world, in managing the virus. So that's why we're seeking to do that.
It seems like only a fraction of what's outstanding is able to be recovered according to the audit report. Why is that? Where's the bulk of that money owed from?
Well, I'd have to let the health department respond to that.
Is it common for government to use private debt collectors for fees? Is this unique?
It's happened previously, no, I know that much. Certainly it was something that was very common in the Newman government when they were in government. We obviously principally recover penalties and fines that are owed to Queenslanders through our State Penalties Enforcement Registry and our team there, the agency there. So that's the principal way we recover that money.
But Spur won't be turning to private debt collectors any time.
No, it's not common, but this is of course an uncommon situation. This is the first pandemic in a century. The states were required to provide hotel quarantine when we saw a failure of the federal government to provide that, and we made it clear to people there would be a fee for that, and that fee was payable. And if you haven't paid it, then we should recover it for Queenslanders, and that's to the benefit of our state.
Are you then expecting New South Wales to call in debt collectors to recoup the hotel quarantine bill they set the Queensland government?
That's entirely a matter for New South Wales.
Is the ambulance system ready for Omicron?
Yes, on all advice that I've received from the Health Minister and the Queensland Health, yes.
What's the plan if, a quarter or half of paramedics end up needing to isolate or, contract the virus? The system seems fairly stretched as it is. Can we afford to...
I don't think it'd be appropriate for me to comment on a hypothetical situation that may or may not happen, but I'm sure Queensland Health would be happy to respond to that.
When it comes to testings, we've seen or spoken to Queenslanders this morning who woke up early, rocked up to testing clinics, only to be told they're already in capacity and there's a 6-hour wait if the clinic's going to close in 5 hours for some of them. What should Queenslanders be doing that are trying to get tested that just can't get a hold of a PCR test?
Well, I think continue to do the right thing. It is a challenging time at Christmas. Our staff who are working here in the infectious disease laboratory here, they haven't stopped, and staff in the public health system have not stopped. They continue to do those tests and carry the burden. Some private pathology labs have closed for Christmas and New Year, which is putting some pressure on the system. But I think the number one thing all Queenslanders can do is continue to get the test, continue to do the right thing. I know it might be challenging and difficult for you, but ultimately that is the right thing to do for yourself, to make sure you've got comfort about whether you've got the virus or not, but also for your family and your friends and the Queensland community.
These are people who are trying to do the right thing to get a test so that they know they're not infecting their household and people around them. So by doing the right thing, what are you suggesting they do because they can't get a hold of the test?
Well, just continue to seek the test wherever you can get one.
And is it true that they're required to, heard from some people who have been told they need to ring ahead and register for a test when they've rocked up to some testing clinics? Is that part of the program as well?
I'm not aware of that.
Can the government offer any more resources for testing beyond what's being offered at the moment?
Well, we've obviously put an enormous amount of resources into the health response to COVID, very significant increase to the health budget, dedicated funding for COVID response, more than $1 billion alone for COVID response, and so we'll continue to provide that funding.
Lockdowns before, for example, can we ramp up even more than what we have at the moment?
Well, we'll take advice. If the health system requires more funding, I can assure you, as Treasurer, the funding is there. Okay. Thanks, everyone.